Hello everyone, good evening. Today on the health tip, I want to talk about Erbs palsy. Erbs palsy, ERB/S palsy, weakness. Erbs palsy is a medical condition or a trauma or accident that happens to little children or newborn during delivery. Erbs palsy is a trauma or maybe an accident that happens to little children during delivery. Some women must have noticed maybe when you give birth to a child, you notice that maybe one of the hands are not moving. You notice maybe again when you give the child hand to lift the baby up, the baby will only move one up while the other hand will be dropped. That condition is called Erbs palsy. At times, some medical condition will tell you it is called shoulder dystocia. Shoulder dystocia. It just means either subluxation or shoulder dislocation. This happens in children during delivery, depending on the individual that did the delivery or what happened. What are the major causes of Erbs palsy? Erbs palsy majorly results in these little children by the action of the doctor or the midwife or the person that delivered that child. Some of the babies, when they are coming out, some don't just crown. The head coming out first. At times, you notice some of them crowns and then one hand comes out with it. So some of these midwives or the doctor that doesn't have the experience to deliver a child normally, they tend to pull that hand out or maybe drag the shoulder. Remember, when that baby is still little, everything is still almost cartilaginous. They are not yet, strong bones. So they can easily dislocate. So when they pull the hand of the child during crowning, they pull it out from the socket. And once this moves out from the socket, it affects the whole hands down because the nerve supply to this hand comes from the neck. Cervical vertebra, that's where all the nerve come from. So when you pull this out, it will disconnect the nerve supply coming from the neck, passing through the hand down. So what are the presentation? You will see this baby will present with what we call waiter's tip. Waiter's tip, meaning internal rotation and wrist drop. This is called wrist drop. So women, you might see your child presenting with something like, let me see if I can be able to stand up this way. That's the position. When you try to lift the child up, the baby will only bring out one hand and this one tends to dangle without power. That is actually called waiter's tip. I'm going to show you again. This is it. The hand drop this way and dangles, no power at all. Some of them are fully flaccid. That is what we call waiter's tip.
You might be the only one, I might be going to.
Okay. That is called waiter's tip or Erbs palsy or policeman hand. That's what we call it. Now, when these occur, you don't need to really panic that much, although it's an injury to that child. But you need to seek medical help immediately. Some of the doctors will tell you, go home, it will correct. Some of the doctors will tell you, don't worry, it will correct itself. No. Some of them may, but 98% will not correct itself. You need medical help for that child. For me, I will recommend you start managing that child from the 5th or the 6th day of delivery. You don't need to wait for months before you start, because the earlier you arrest the situation, the more the baby recovers. There is a possibility of treating that child and the baby will recover 100%. Yes. But remember, when you see the condition that have stayed for long, you notice what we call discrepancy. The hand will be shorter than the other one. The affected hand will be shorter than the other one. And once it's shorter, the next thing also you notice it will look a bit tinier. The muzzle bulk will be little or lesser compared to the normal one. I hope I'm communicating. So those are the presentation of Erbs palsy. And how do you notice? The first one, when you want to lift your child, the baby is supposed to lift both hands to grab the mother or for you to lift the child. But they will drop one and bring only one up, showing you there's a problem on one of the hands affected. This Erbs palsy can be divided into 3 types, depending on the nerve damage. The first one is called neuropraxia. That's a partial compression, like I mentioned before, recovers between 3 months to 6 months. It will recover fully. The next one is called axonotmesis. This one recovers between a year or a year and 6 months. Then the next one is called neurotmesis. This is a total transection and damage. It does not recover at all. Moving forward, when you notice your child presented with Erbs palsy, don't panic. Don't feel like your world has ended. No. Take that baby straight to a well-trained and enlightened physiotherapist. Forget about the GP. Yes, I know what I'm telling you. Go straight to the physio. They will review the child and start the rehabilitation immediately using functional EMS, TENS, and many other things depending on the manner of approach that physio wants to use. But believe you me, if you do that earlier, you can be able to secure the future of that child. That hand might recover 100% depending on how early you seek medical intervention. This is another episode on the medical tip. Please feel free to share this to anyone you know. Pass on the information. Sensitize the public. Don't follow to share. Don't forget to share, and don't forget to follow me. Thank you for your attention. Thank you for your understanding. Health is wealth. Bye-bye. See you in the next episode.